So for next test, which is very important in gynecology, we're looking at what's known as a Rubin's test. Rubin's test. So Rubin's test is more of like I'm actually inflating fluid into the fallopian tube. So Rubin's test is also known as what? Uterotubal insufflation. So it's just a diagnostic procedure. It's used to determine whether a woman's fallopian tube is open. Do you understand? Because sometimes you can have some disease conditions that can block the fallopian tube. Do you understand? So you just want to confirm. So it was once a common method for evaluating infertility, although now it is largely replaced by the various tests for infertility that we do. All those estrogen tests, progesterone tests, those ones are very much more easy, But as medical students, we study things that are in existence and also things that are not in existence, that were once existing too. So how it works, we said that carbon dioxide gas is introduced into the uterus via a cannula. So it's not actually fluid, it's carbon dioxide. The gas travels through the fallopian tubes. So if the tubes are open, the gas escapes into the abdominal cavity. Do you understand? Often it will now cause reflex shoulder pain due to diaphragmatic irritation. Do you understand? So a manometer measures the pressure change to access the tubal patency. So the whole thing is this: if the fallopian tubes are not open, alright, this gas can actually get into the abdomen. Alright, it will have to follow back through the vagina out. So the pressure readings, if the pressure is read between 80 to 100, it's normal patency. 120 to 130 shows that there's a partial blockage or stricture. Right? Then anything more than 200 suggests that there's complete obstruction of the fallopian tube. Alright? So for the risks and limitations, it can cause air embolism if air is used out instead of carbon dioxide. Right? Cause infections, bleeding, discomfort. So it can only confirm if at least one tube is open. Doesn't provide detailed anatomical information. Can only give you a clue. Alright? Doesn't actually tell you the right thing that is actually wrong with the fallopian tube.